The Franciscan Sisters of Allegany began their journey into healthcare in 1883 when they were asked to undertake the management of St. Elizabeth Hospital in Boston, Massachusetts. Since its foundation in 1859, the congregation's principal ministry had been in education. Although the young congregation had no experience in hospital administration, the sisters voted to undertake the management of the hospital. In 1890, following the success of St. Elizabeth Hospital in Boston, the sisters undertook the management of a second hospital in New York City, also named St. Elizabeth. Both hospitals had been previously run by secular Franciscan women who went on to become professed members of the Franciscan Sisters of Allegany. It did not take long for both hospitals to develop a fine reputation in the cities in which they served. The sisters worked hard to live their Franciscan tradition of caring for those who are poor and marginalized. Great care was taken to accept all patients, regardless of their ability to pay. In Boston, when faced with a patient unable to pay the $7 weekly fee, the sisters went begging for donations. As the facility in Boston expanded, the sisters also admitted patients with chronic illnesses, such as tuberculosis, that other hospitals refused to care for. At St. Elizabeth's in New York City, great pains were also taken to accommodate those patients who were unable to pay. In 1927, the Allegany Franciscans branched out from the northeastern United States to respond to a call for help in Florida. In Miami Beach, a hospital facing financial ruin reached out to the sisters. Allison Hospital had been established by an Indiana businessman as a luxury hospital, with a French chef, extensive landscaping, and an electric fan in every room. The luxurious accommodations only allowed the richest patients to be admitted to the hospital. Against the advice of many sisters and friends, General Superior Reverend Mother Dominica Enright trusted the guidance of the Holy Spirit and accepted a contract to run Allison Hospital. She sent the shrewd and inventive Mother Alice Henry, accompanied by 5 additional sisters, to Florida. Prior to becoming administrator at Allison Hospital, Mother Alice spent more than 20 years at St. Elizabeth's Hospital in Boston, where her dedication to her patients was legendary. She put all of her experience to good use, slashing a bloated budget in order to turn the hospital's finances around. Once a week, she would rise at dawn to go to market and buy fresh produce for the patients. Any food that was left over at the end of the day was distributed to those in need in the Miami Beach community. Additionally, Allison Hospital began accepting patients from all economic levels. In 1928, the Allegany Franciscans purchased Allison Hospital and renamed it St. Francis Hospital. It became the first hospital in southern Florida under Catholic management. The Bishop of St. Augustine was so impressed with the work of the sisters at St. Francis Hospital that he invited them to open up more facilities in the diocese. In 1931, following the extensive appraisal of Mother Alice, the congregation purchased the former Faith Hospital in St. Petersburg. Over the course of the summer, extensive renovations were made to the building, and on November 1st, 1931, the newly christened St. Anthony's Hospital became the first Catholic hospital on Florida's west coast. The new hospital quickly gained a reputation for compassionate care, respect, and dignity. Those values continue to guide the hospital today. Several years later, the sisters were asked to establish a hospital in Tampa, Florida. After careful consideration, Mother Alice selected the unfinished Tampa Heights Hospital as the best site to open a new hospital. The sisters set to work completing the building, often helping with the construction and renovation with their own hands. On October 1st, 1934, St. Joseph's Hospital opened its doors. During the Great Depression, St. Joseph's was an invaluable source of employment for the medical professionals of Tampa. Today, St. Joseph's continues to provide compassionate care in the Tampa area, ensuring that the complete needs of each individual are met regardless of faith. Shortly after St. Joseph's Hospital opened in Tampa, Mother Alice was called back to New York to assist in establishing a hospital in New York City. On November 1st, 1934, St. Clair Hospital opened its doors, with Mother Alice serving as its first administrator. St. Clair's opened in challenging circumstances. Not only was it located in Hell's Kitchen, one of the poorest parts of town, it was also $200,000 in debt during the Great Depression. However, Mother Alice was undeterred. She immediately began advertising to attract doctors to the new hospital. Her only criterion for hiring a doctor was talent. Race, religion, and nationality were immaterial. The sisters at St. Clair's worked tirelessly to provide patients with the best care possible with very little money to spare. In the crowded hospital, they often gave up their own beds to ensure that no patient would be turned away. In the summer months, the sisters spent hours preparing hundreds of jars of preserves and mincemeat for the winter months. Their tireless sacrifice, combined with Mother Alice's renowned frugality and charm, made St. Clair Hospital a success. In 1936, the decision was made to bring the Allegany Franciscans healthcare ministry closer to home by constructing a hospital in Olean, New York. Situated 2 miles from the Mother House in Allegany, St. Francis Hospital was originally conceived to provide health care for the aging sisters, but it was soon decided that the hospital's mission would be extended to serve the general public in the Olean-Allegany area. St. Francis Hospital opened on August 1, 1938, with 100 beds and the most modern equipment available. In 1937, the Allegany Franciscans took over the management of St. Joseph Hospital in Providence, Rhode Island. The hospital had been previously managed by the Franciscan Sisters of Philadelphia. After those sisters withdrew, the Allegany Franciscans were asked to take on the hospital. The sisters later merged the hospital with Our Lady of Fatima Hospital, also in Providence, and administered the two hospitals together. In 1939, the sisters again turned their attention to Florida. The residents of West Palm Beach believed that a convalescent home was needed in the community, and they turned to the Allegany Franciscans for help. General Superior Reverend Mother Jean Marie Greeley traveled to West Palm Beach, accompanied by Mother Alice Henry, to consider the proposal. Upon arriving, the sisters were given a 10-acre piece of land on which to build a convalescent home. At Mother Alice's suggestion, a 50-bed facility was planned for the site. St. Mary Nursing Home was completed in 1939. Within a year, however, plans were made to expand the nursing home into a general hospital. In 1942, a new wing was blessed and St. Mary Hospital was established. In 1947, the congregation was asked to take over a second hospital in the West Palm Beach area, called Pine Ridge. Pine Ridge was the only hospital in the 5-county area that served the 55,000 African American residents, and it was in deplorable condition. The sisters agreed to take on the hospital, but were met with considerable opposition from the Bishop of St. Augustine. After referring the issue to Rome, permission was given for the acquisition to take place. In 1950, Pine Ridge Hospital was placed under the administration of St. Mary Hospital in order to provide better services. Several years later, the decision was made to build a state-of-the-art addition onto St. Mary Hospital to accommodate the African American patients who had previously been admitted to Pine Ridge. Despite the objections of the white community members who did not want African Americans to have access to the newest facilities in the hospital, the sisters were undeterred. In 1956, the patients at Pine Ridge were transferred to the new North Wing of St. Mary Hospital, and Pine Ridge was closed. Meanwhile, in Camden, New Jersey, the Bishop of Camden had been urging the sisters to open a hospital in the diocese. In 1947, after a fundraising drive to which people of all faiths contributed, construction began on a site picked by Mother Alice Henry and Reverend Mother Jean Marie Greeley. In 1950, Our Lady of Lourdes Hospital was opened. Now known as Lourdes Health System, today the hospital is one of southern New Jersey's leading healthcare providers. The sisters did not restrict their hospital building to the United States. In 1960, General Superior Reverend Mother Joan Marie Wheeler visited the congregation's missions in Brazil. During that visit, she made an important decision. The sisters would build a hospital in the city of Anápolis in the Brazilian state of Goiás. In 1961, Santa Casa de Misericordia was blessed and opened. To this day, the hospital provides compassionate healing to those who are poor and underserved in the city and surrounding rural areas. Healthcare is provided to the impoverished without distinction of race, creed, color, or political ideology. By the early 1970s, following the rapid growth of the sisters' mission in healthcare, the Allegany Franciscans administered 8 hospitals and 2 long-term care facilities. While the sisters' commitment to their healthcare mission remained strong, the number of young women entering the congregation every year was in decline. Recognizing the growing challenges associated with managing so many hospitals, the sisters embarked on a comprehensive evaluation of their presence in healthcare. This evaluation led to the sisters slowly making the painful decision to withdraw from several of their hospitals and healthcare facilities. Meanwhile, the remaining healthcare facilities administered and sponsored by the Allegany Franciscans were beginning to struggle with a highly competitive and restrictive healthcare climate in the United States. For this reason, in 1983, the Allegany Franciscans merged their healthcare facilities, which had previously been managed independently of one another, into the Franciscan Sisters of Allegany Health System Incorporated, also known as AHS. In 1997, AHS would become one of the founding members of Catholic Health East, a multi-institutional Catholic health system with facilities in 11 eastern states. Today, Catholic Health East is merging with Trinity Health to create one of the largest Catholic healthcare systems in the country, serving communities in 21 states. Today, the Franciscan Sisters of Allegany sponsor 4 hospitals: St. Joseph's Hospital in Tampa, St. Anthony's in St. Petersburg, Our Lady of Lourdes Health System in Camden, and Santa Casa in Anápolis, Brazil. Although most of these hospitals are now administered by lay members of the communities they serve, the Allegany Franciscans have an ongoing presence in the hospitals as nurses and senior administrators, helping to ensure that these facilities stay true to their mission of providing compassionate healthcare to all people. Even though the Allegany Franciscans have closed or withdrawn from many of the hospitals they once administered, their mission to serve those who are poor and marginalized with compassion and dignity endures. Following the 1991 merger of St. Francis Hospital in Olean, New York, with Olean General Hospital, a foundation was established to provide aid to those in need in western New York and northern Pennsylvania. Named for Dr. Lyle F. Renaudin, the Renaudin Foundation awards thousands of dollars in grants every year to local nonprofit organizations that seek to provide aid to the most vulnerable residents of the local area. The Renaudin Foundation is committed to the gospel stance of social justice, which is lived out in a spirit of love, healing, and compassion. In Florida, Allegany Franciscan Ministries Incorporated continues the Sisters' mission of meeting the needs of the poor and marginalized members of society. Created through the divestiture of assets when St. Joseph's and St. Anthony's joined Baycare Health System, AFM provides grants to nonprofit organizations in several regions of southern Florida. AFM strives to be a catalyst for systemic change in each region by providing funds and working collaboratively with other nonprofit organizations to promote physical, mental, spiritual, societal, and cultural health in the communities it serves. Throughout their journey in healthcare, the spirit and mission of the Franciscan Sisters of Allegany has remained strong. Their commitment to compassionate care, as well as the recognition of the dignity of all people regardless of race, religion, or socioeconomic status, remains a guiding light in the hospitals and the foundations that they built. The healthcare ministry of the Franciscan Sisters of Allegany continues to abide by the directive given them by their foundress, Reverend Mother Teresa O'Neill. Respond to the needs of the people.